I'm Ainsley Craig, and I will be presenting the 2017 PATH International Field Test Standards webinar today. Today's webinar will explain the rationale for our field test standards that membership will be voting on in the PATH International Standards Field Test Vote that will be running from the 1st through the 14th of July this year. Additional information on the field test standards for members is available in the 2016 PATH International Standards Manual and at PATH International Community Connections. Members may also contact their region representative for more information. There are 5 field test standards for vote this year, but there are 4 field test standards that are connected. FTS 1 through 4 will be replacing standard A32. A32 is a mandatory standard that is active in the 2016 manual. Some information on this is that these standards will not replace A32 until all 4 FTS standards pass a membership vote. So it's an all or nothing thing. They will go in and replace once the complete vote is done. The 4 standards replacing the 1 standard are intended to clarify for members which equine activities are appropriate for helmet exemptions and exceptions. They will also provide clear policy and documentation requirements for centers, and they update the standard to include ASTM SEI international equivalents. For reference, I'm going to go back and we're going to show you mandatory standard A32, which is currently in the 2016 standards manual. So the standard requires, and verbatim is, are participants, volunteers, and personnel required to wear, and in fact do wear, protective headgear that is American Society for Testing and Materials Safety Equipment Institute approved for equestrian use while mounted or driving. Helmets that are not ASTM SEI approved for equestrian use must meet Professional Association of Therapeutic Horsemanship's international guidelines for alternative helmet use. And it says see guidelines. So the interpretation says that it's the center's responsibility to verify the currency of ASTM SEI approved protective headgear, that it must be approved for mounted and driving, but is recommended for during ground work or with or near equines, grooming, tacking, leading. The compliance demonstration is that visitor observation of a session and verification of ASTM SEI tags in randomly selected helmets. So that is how the standard reads currently in the current manual. So FTS 1 is going to be a mandatory standard, and it will be placed in the admin section of the core standards manual. So this will go basically and replace A32 for the administrative section. So FTS 1, it separates the helmet requirement for volunteers and personnel. So these are people that are not participants in your program, but they're people who may be mounted or driving or vaulting at your program. It additionally adds acceptance of international equivalent helmets. So FTS 1 mandatory says, does the center have an implemented written policy that all volunteers and personnel wear a helmet certified by the American Society for Testing and Materials Safety Equipment Institute, or an international equivalent helmet for equestrian use while mounted, driving, or vaulting? So the interpretation says this standard applies to personnel and volunteers while engaged in mounting, driving, or vaulting in center activities. It is the center's responsibility to verify the currency of the ASTM SEI or international equivalent approved protective equestrian helmets. For information can be verified by contacting SEI at www.seinet.org and looking up equestrian headgear helmet. Helmets should fit snugly and have a harness strap adjusted incorrectly. Helmets should not interfere with the individual's vision. So visitor demonstration is compliance demonstration is that visitor observation of written policy, verification of ASTM, SEI, or international equivalency tags in randomly selected helmets, and personal interview. So this standard does a couple of things. It updates and allows for international equivalent. It also specifies that the ASTM, SEI approval has to be for equestrian use. It delineates that it is a volunteer or center personnel, which would be for staff, must wear helmets while mounted, driving, and vaulting. There's no exemption, there's no exception. They can't wear an alternative helmet, they can't go helmetless for any of these activities. If they volunteer or are personnel at your staff, they have to be helmeted. And the written policy is good for centers. It may seem like an additional, oh, we've got just another written policy, what do we have to do? But this actually kind of can assist you if you've got that volunteer or that board member that we all have that says, I don't need a helmet, I'm such a good rider. You can say, well, you know, it takes the personal out of saying, no, you have to wear a helmet because here's the written policy saying that all volunteers and all personnel must wear a helmet, and it's a mandatory requirement from PATH International. So it kind of helps you and takes the personal out of asking people to wear a helmet, those that don't want to wear a helmet. So that is FTS 1. So FTS 2, it delineates the requirements for mounted activities, and if it passes, it will be placed in the mounted activity section of the manual. So if your center has mounted activities, if they provide mounted activities for any participants, then you will have to abide by FTS 2. So FTS 2 in verbatim is, do all participants wear a helmet certified by the American Society for Testing and Materials Safety Equipment Institute or an international equivalent helmet for equestrian use while participating in a mounted activity? If a helmet is not ASTM, SEI, or international equivalent approved for equestrian use, is worn for mounted activities, is there written documentation meeting the Professional Association of Therapeutic Horsemanship International Guidelines for alternative helmet use? So what this is saying is that for mounted activities, you have to wear an ASTM, SEI approved helmet approved for equestrian use. But it's allowing for mounted activities alternative helmets. And the alternative helmets, these guidelines have been in the standards manual for many years, and the guidelines lay out what situations alternative helmet can be used and for what type of clients and when they are appropriate. So those guidelines have not changed, but they are only appropriate for mounted activities. And so if you were looking to use an alternative, if you had a participant that you thought might fall under the alternative helmet use guidelines, you would go to the guidelines and you would look up to make sure that they meet the guidelines as a participant and that you as a center meet the guidelines for alternative helmet use. So the compliance demonstration is visitor observation of center mounted activities, verification of ASTM, SEI, or equivalent international tags in randomly selected helmets, and written documentation for all individuals using alternative helmets in mounted activities and personnel interview. So the only difference that this standard has from A32 is that we look for the written documentation that's required by the alternative helmet guidelines. So the next standard, which is FTS 3, will replace A32, and it will be put into the driving activity standards section and of our standards manual. So FTS 3 is again mandatory, and it states, do all participants wear a helmet certified by the American Society for Testing and Materials Safety Equipment Institute or an international equivalent helmet for equestrian use while participating in a driving activity. And the compliance demonstration is visitor observation of center driving activities, verification of ASTM, SEI, or equivalent tags in randomly selected helmets, and personnel interview. So what this is saying is that for driving, there are no alternative helmets allowed. That when you're driving, if a participant is driving, they must wear a helmet that is either ASTM or international equivalent. There are no exemptions and there are no exceptions for driving activities. For FTS 4 is the interactive vaulting activity helmet requirement, and it will be placed in the vaulting activity section of the manual. So you'll only see this standard and the mounted standard and the driving standard if you are doing those activities. So FTS 4 mandatory is, do all participants wear a helmet certified by the American Society for Testing and Materials, Safety Equipment Institute, or an international equivalent helmet for equestrian use while participating in interactive vaulting activities. If a participant is not using an ASTM, SEI, or international equivalent equestrian helmet while participating in interactive vaulting activities, is there written documentation meeting the Professional Association of Therapeutic Horsemanship International guidelines for non-use of helmets in interactive vaulting? So what this is saying is that vaulting, you must use a ASTM, SEI equestrian helmet or international equivalent, or you have to abide by the guidelines for non-use of helmets in interactive vaulting. And the compliance demonstration for this is visitor observation of center interactive vaulting activities, verification of ASTM, SEI, or equivalent tags in randomly selected helmets, written documentation for all individuals not using helmets in interactive vaulting activities, personnel interview. So the written documentation is outlined in the guidelines for non-use of helmets in interactive vaulting, and those have not changed. So this is just saying that we're kind of separating out and making it so the exemptions are for interactive vaulting only, and they're in FTS 4, and the exceptions, and the exceptions for the alternative helmet is in FTS 2, and that's the mounted activity. So FTS 5 is a standard that concerns the minimum safe age for participants in equine-assisted activities. And it follows the age recommendations found in the precautions and contraindications section of the standards manual. This standard was proposed by the Health and Ed Committee to emphasize the need to closely evaluate young participants before placing them on an equine. This standard was voted on in July 2015. However, after the vote, it was pointed out that the previous explanation stated that it would be in field test for 2 years, and it had only been in for 1 year. So the PATH International Strategic Initiative Review Committee voted to place it back into field test for an additional comments, so it will be voted on again this year. So FTS 5 has a DNA, so it does not apply if the mounted, driving, or interactive vaulting activity occurs under the direct supervision of a licensed medical provider trained in hippotherapy. The standard states, does the center have a written and implemented policy that all participants must be at least 4 years of age or older to engage in mounted, driving, and/or interactive vaulting activities? So the interpretation basically goes through some of the things that might occur and some of the risks that are inherent in putting very small or infant children on equines. The risks include Immaturity of the spine might include microtrauma to the cervical spine. You might have a whip-like effect for a child with poorly developed head control. And also, it states that because of the way we develop our natural walking gait patterns with respect to the pelvis, children under the age of 3 don't develop the natural gaits and don't have their gait mature enough to have it be influenced properly by the horses or the equine's gait. So unless you're working with a licensed medical provider that is trained in the use of hippotherapy as a treatment strategy, working with anyone between 2 and 4-year-old really has too many risks associated with it, and sitting astride from an equine for a small child can stress the hip joints, they can dislocate the hip, and additionally, children with developmental delay may have a younger developmental age than their chronological age, which may impact safety. So safety awareness is always a precaution for people with cognitive delays. The compliance demonstration for this is visitor observation of written policy and observation of mounted driving and or interactive vaulting activities, including interview of center personnel. So what we're saying with FTS5 is that between the age of 0 and 2, there can be no clients on a horse. Between 2 and 4, a medically licensed provider who is specially trained in hippotherapy techniques may provide direct service to a client, and then at age 4, therapeutic riding activities begin to become appropriate for the clients. So we've gotten some comments. We've been having these in field test, and some of the comments that we've gotten from the region conferences, from the field test standards hearings at regional conferences, we'll go over and we'll answer those questions as best we can, so that you have an idea, and if you have some of the similar questions, maybe we'll be hopefully clarifying some things for you. So should FTS 1, 2, 3, and 4 be combined? Obviously, we feel no, they should be separated out. And again, the reason we're doing that is because we want to make them specific and target the specific activities that we need they need to be used for. So FTS 1 is targeting volunteers and personnel. FTS 2 is talking about and targets mounted activities and alternative helmets. FTS 3 targets driving activities, and FTS 4 interactive vaulting, helmets, and activities, and the non-use of helmet. So we had a question, should international equivalents be added? And yes, we did add them to the field test standard as the standard was maturing. And should volunteers wear helmets? And that is required in FTS 1. Yes, volunteers should be wearing helmets. So a question on FTS 3, which is the driving helmet standard, is would FTS 1 and FTS 3 both need to pass to ensure the able-bodied whip still wears a helmet? And should there be suggestions of alternative helmet use? So for FTS 3 for driving, there's no alternative helmet in driving. You have to wear a helmet. And again, FTS 1 and 3 will both pass before it replaces A32. So that would be a yes. So FTS 4, could there be a DNA? We did not put a DNA in FTS 4 for the helmet exemption because of the requirements in the guidelines for the exemption. So if you're not wearing a helmet in vaulting, you have a requirement for some written documentation. So if it was a DNA, then it wouldn't refer you to the guidelines. So there is no DNA in FTS4 because the exemptions have guidelines have written requirements for documentation. And also somebody asked if we should take out the word recommendation because they felt it was creating a liability. And that was discussed, but the word was left in. So we do not feel that it would be creating a liability. In FTS 5, they asked, would this be implying that anyone, regardless of age, who has low developmental age is not appropriate fit for therapeutic riding? And that is not the intent. What we're saying is that any child between the age of 0 and 2 is not appropriate to be put on an equine for therapeutic riding. And between the age of 2 and 4, that the risks and the specific dangers of putting a child on an equine between the age of 2 and 4 require additional knowledge, and that knowledge is only really gained by licensed medical providers who have special training in hippotherapy. It is not something that is taught or is expected of registered or advanced or master level therapeutic riding instructors. So it is not that it's not low development age, it's actually physical age. And then there are also additional dangers with the added developmental age for the very young client. So another question is, could a client above the age of 2 be screened for appropriateness? And because of the inherent risk, it's felt that anyone above the age 2, the only person who can screen and actually watch for the indications of any significant danger would be a licensed medical provider with additional training in hippotherapy. So they are screened for appropriateness at the age of 2 by a licensed medical provider, and additionally the licensed medical provider is the only one who can provide the service because they need to use their medical knowledge to determine whether the activity is actually helping or harming the client. So they are screened for appropriateness at the age of 2, but only by therapists, and therapists are the only ones, or medical providers are the only ones who can provide this service. So that is the end of our webinar, and I hope we've cleared up some information for you and that you feel more qualified or to use your vote for the membership, and whether you vote for the standards to pass or not. We hope we've clarified some information and some intent for this, and I appreciate you going through and listening, and I wish you a good day. Thank you.